Her Royal Highness Princess Dina Mired, the Director General of the King Hussein Cancer Foundation, joins us on the show right now. Good morning, Your Highness.
Good morning.
How are you?
I'm fine, thank you. And Ramadan Kareem to everybody.
And Ramadan Kareem to you as well, Your Highness. Now, we'd like to start off by telling us a little bit more about the King Hussein Cancer Foundation.
The King Hussein Cancer Foundation is the legal umbrella organization responsible for the King Hussein Cancer Center, which is the foundation's medical arm. The foundation has a board of trustees and a dedicated group of volunteers, wonderful volunteers, chaired by Her Royal Highness Princess Dina. And the center, our wonderful center that everybody knows about, the King Hussein Cancer Center, is chaired by Dr. Mahmoud Sarhan, who's our amazing director, taking care of our center and making sure that medically all our patients are getting the best treatment.
So can you tell us about the international accreditations that the King Hussein Cancer Center received, and what does it mean to a cancer patient to have such accreditations?
Yes. Our main goal, of course, we as a foundation, we fundraise to make sure that our center remains ultimately a center that gives the best and most updated cancer treatment to our patients. As you know, cancer only knows excellence in treatment. Otherwise, there is no point of having a treatment. Therefore, the center has received an amazing accreditation from the international body that accredits hospitals and centers. And this accreditation basically, and the body is called the Joint Commission International, JACO, short for JACO. And basically, they looked at our hospital. At first, they checked it out as a general hospital. They made sure that we have the right team, the right staff, the right rules, etc. And we received our first general accreditation in 2006. However, in 2007, we were awarded the most prestigious accreditation, which basically they awarded it to KHCC as a cancer-specific center, which means they looked at all our cancer protocols, the level, the qualifications of the doctors, the nurses, the treatment, etc. And basically, they saw that we are. They gave us accreditation on being a fantastic cancer center. And I would like to add that we are the only center outside of the U.S. that has this fantastic accreditation. And what it really means to patients, it's not just a poster on the wall. It really means that if you have a loved one or a dear one being treated at the center right now, it means that you are giving that loved one the best treatment. And it's the same treatment that person would have had in U.S. or in Europe. And that's really important.
So what are the fundraising programs of the King Hussein Cancer Foundation?
The King Hussein Cancer Foundation, we were very keen to allow each and every one of us to join the fight against cancer. Because as you know, everybody has either a neighbor or a friend or a loved one who unfortunately is fighting the disease. So we created so many programs to allow everyone to join, from the person who only has piasters to donate, to a JD, to hundreds of dinars, to thousands of dinars, and so on. And one of the ones that I'd like to point out is our coin collection program. I'm sure you have seen it in supermarkets, in banks, in malls, etc. This program, people love to put their coins in our boxes, and and every penny we receive, and I want to tell everyone who's donated in those boxes that they are directly helping saving the lives of patients. The other one, I'm sure you have seen as well, is the restaurant care program. And that is, one JD is in the top restaurants in the kingdom. One JD is added to the bill to benefit the King Hussein Cancer Foundation. Of course, it's voluntary, but this program has really, and people love it, they really save lives while dining. And this is a very important program that helps us to give all the services and support to our patients that we do give. We have another one called the Hotel Care Program with the same principle, with all the top hotels in the kingdom. Again, one JD is added to the bill. And we have many, many more, of course. And you can also join the fight by simply coming to our offices and donating money by check, by cash. and online as well.
Now, there are many underprivileged cancer patients who cannot cover this treatment costs. Now, are there any specific programs that help these patients?
Yes, it really is very much relevant to this Zakat campaign. And I want to say here that I loved this year's slogan, Zakat, My Life, because it is exactly what really happens when all these donors who actually direct their Zakat to our Zakat fund, they are literally allowing us to help one more patient, one more underprivileged patient on our waiting list. So literally, when you direct your Zakat, you're really directly helping save the life of someone who does not have anybody else to cover their treatment. And so this is, so I urge everybody to direct their Zakat funds to us. The other thing, we have the Goodwill Fund, which is the same idea. People direct their other donations to the Goodwill Fund, which is solely to help underprivileged patients, from covering their treatment costs from A to Z or part of their protocol costs, giving them transport, those people who sometimes don't even have the money to come by taxi or by bus to and fro to the center, they live far away, or accommodation costs, those people who absolutely have to stay very close to the center, especially those who underwent bone marrow transplant. We actually cover their accommodation costs at a nearby simple hotel just to be close to the emergency room at the center, and so on. And I would like to add that, we've got the official fatwa from the Islamic Council for our Zakat fund to be eligible to receive the Zakat. And, I have many more patients still on the waiting list. Again, this is something sometimes people don't realize. We can only help with people helping us. Otherwise, we don't have the millions that are needed to help, all the patients that we need to help.
So let's talk more about the actual Zakat campaign for this year. What's it been about this year?
This year, apart from the Zakat that I said, the general Zakat that I just spoke about, that you just directed to us by calling our number at the foundation, 5544960. If you call us and you say you want to direct your Zakat, you can either come yourself or we will send someone to collect it. The other simple way is also to fulfill your Zakat al-Fitr or your Sadaqah. It's very simple this year. Basically, with all the mobile companies, Zain, Orange, and Omnia, and I'm really thankful for them to join all together for this one cause. Basically, especially your young audience, they all have mobiles. They can send a text message to, for instance, if you have a Zain number, you send it to the number 97070. You put the word life, and by so doing, you are donating 1 JD to us. If you have an Orange number, you have 4 9s and a 7. The same thing with the word life. You have donated to us 1 JD. And Omnia is 4 9s and an 8, and the same thing. And I want to add, there are so many people have been sending not only one message, multiple messages. So I urge everyone, please, this is the simplest way of helping cancer patients. Do it right away as you hear this message, and help us to help one more patient who absolutely needs treatment and doesn't have the money.
And how many patients so far have benefited from the Zakat Fund?
Yes, from 2006, since we first created it, until now, but excluding this particular campaign because we won't know the results till the end of the month, we have been treated close to 1 million dinars, about 95 underprivileged cancer patients. And I want to add here, cancer coverage is so expensive, unfortunately. The average treatment cost of one patient is around $25,000 plus dinars, plus or minus. And so with this money, we've either helped some people A to Z, some people we've helped them with part of their protocol treatment. Whatever we have, if the fund, absolutely all of it goes to help people.
So, of course, it's all for a fantastic cause. And is there any last words that you would like to leave us with for anybody listening to the show right now that would like to...
And I would like to thank each and every person who has donated to us, either by sending a text message, putting in our coin boxes, joining us, volunteering with us, whatever you do. Thank you so much.